Hi guys, I'm back. So the other day I started out with 4 patients and I sent one to like a med-surg floor during the afternoon, and then I sent my other 3 home, and I got an admit at 4 o'clock in the afternoon, and I had 1 patient for like 3 hours. What a great day I had, right? So not every day is so crazy busy that you can't get anything done. I mean, I was busy, but I sent everybody home safely by 3 o'clock, and then I got to go eat lunch. There are some days in nursing where you have like a couple hours where just nothing's really going on and you're kind of waiting to give those meds or check that blood sugar or waiting for a doctor order to pop up, so sometimes you do have a little bit of downtime. There are some days when I'm pretty much finished with everything around 4 o'clock. And then I'm sitting there watching the clock move at a glacial pace, waiting for it to be 7 p.m. so I can go home. Some people believe that nursing is really stressful and that you want to cry and rip your hair out every day. But let me tell you, I rarely have days like those. Some days I do feel overwhelmed, and if I do feel like I have like 5 things to do at once and there is in fact only one of me, then I do the most important thing first and all the other duties can get in line and wait. That's just the way it is. And I understand that people have different personalities and deal with situations a little bit differently. When I first graduated, I used to work with this one nurse, and she was always flustered and semi-anxious, and she would come up to me with a worried look on her face and say, "Heather, I have this, and this to do, and I'm running around like a chicken with my head cut off," which is what people say when they're really busy. That reminds me of this funny comic that I saw posted at work. There was like this farmer who was walking with an axe, and he was nearsighted, and next to him were a couple of turkeys, and in front of him was a cow, and so the turkeys were like, "Moo!" And since the farmer couldn't see, he like walked right past the turkeys and went towards the cow to kill it. Those naughty turkeys. I thought it was kind of funny though. But back to my story. So when working with this nurse, I used to think, why is she so stressed out? Just take one task at a time and complete it, and eventually you'll complete mostly everything you have to do. Seriously, you will. And of course, there are days when I feel a little overwhelmed and I feel like I'm drowning. But most days I like feeling a little bit stressed because I think of it as this puzzle that I have to complete really quickly. So an example of a smooth discharge puzzle would be to go and print out your discharge instructions and get the prescriptions, go over the discharge instructions with them and give them the prescriptions. Then you take off their telemonitor, get them dressed and packed and ready to go, take out their IV, put them in the wheelchair, say au revoir, and then do your discharge note. Yay! The discharge puzzle's complete! Well, that's the way I like to look at it anyways. Well guys, thanks for watching and happy Thanksgiving! Talk to you later, Kay? Bye!